Come again.
Hello, and welcome to the American Massage Conference pre-conference broadcast series on Massage Therapy Radio. I'm Felicia Brown, and I'll be your host for this interview and series. This is one of several broadcasts with the presenters and experts who are appearing at the American Massage Conference May 20th through 22nd, 2011. The inaugural event is being sponsored by Massage Today, Massage Envy, Massage Warehouse, and ABMP, and will be held in beautiful Atlanta, Georgia. Our special guest today is Paul Lewis. Paul and I will be talking about his class at the American Massage Conference, post-surgical treatment of mastectomy and breast implants. Paul Lewis, and let me start by telling you about Paul. Paul Lewis is first and foremost an educator. He believes there should be no secrets or tricks of the trade, and tricks of the trade need to be shared with other therapists for their own sake and to benefit clients. He is a registered massage therapist and a Canadian, U.S., and European accredited and approved provider. Paul has developed his own unique and effective treatment style called Dynamic Angular Petressage. As a result, he receives many referrals to his Toronto clinic. Paul is an international presenter combining his knowledge and experience into interactive and informative workshops and seminars with a focus on biomechanics and technique, allowing you to practice massage therapy with ease and grace and without strain on your body. Paul has presented and is scheduled to instruct upcoming workshops in Canada, the U.S., Japan, China, and England. Paul also created and is featured in his Telly Award-winning multilingual in-chair massage instructional DVD available worldwide at www.paullewis.ca. Paul, welcome to the American Massage Conference pre-conference broadcast series. It's great to get a chance to catch up with you and to talk to you today about your class, Post-Surgical Treatment of Mastectomy and Breast Implants.
Hi, Felicia. I'm excited to be here, and it's nice to talk to you again. Can you hear me? I'm just talking into the mic here.
I can, but a little bit deeper is always better. You never know how these recordings are going to pick up.
Okay, perfect. How's that?
So, we're really glad to have you here today, Paul. I'm really interested to learn about your topic. But before we get into that, I'd like to ask you, why did you want to be involved in the American Massage Conference in Atlanta?
In Atlanta? Well, first of all, I've never been to Atlanta, so that's sort of exciting for myself. In addition, as we know, learning is a lifelong experience. Even though you may finish university or courses that you may take, the learning never ends. And I see the American Massage Conference as an opportunity to help not only students and other therapists, but also myself. And when I say help myself, is wherever I go, you can always learn. It's never ending. The learning process is never ending. So this is being the inaugural in Atlanta, me never having gone to Atlanta, and this being the first American Massage Conference, I feel an opportunity and very thankful that I was invited to go to and be able to present at the conference. So you can see I'm sort of getting overwhelmed with emotion about educating and receiving information and meeting other therapists and getting to know other students and just helping each other. That's the way I look at it. It's not a one-way communication, but a two-way communication going back and forth.
Well, definitely. I always tell my own students that I have as much to learn from them as they do from me, and that we're all really there to help each other.
That is so true.
So is there anything in particular, Paul, that you're looking forward to at the American Massage Conference?
I believe I looked through the pamphlet one time, and there's quite a few different events and functions happening there, and there's probably too many to mention, but overall, I'm looking forward to the camaraderie and meeting different people from different areas of the country. I think people are coming from worldwide, I believe, different locations, and to come together under a commonality of learning and experiencing the best in the industry and just learning from each other. So that's one main thing that I'm looking forward to. Plus, we have, I believe, new products, exhibitors that will help to bring me up to date on new products and what's actually out there in the industry.
Well, there'll definitely be a lot of chances to learn about new products, and you're right about the international side. For sure, there are going to be a lot of Canadians there, including yourself, and I'm sure that we'll have people from all over the world. Certainly, this is such a great learning opportunity that people worldwide are going to be interested in it, and this first conference is really exciting because it's the first one. So,
well, that's true. Yes.
Yeah, it's going to be a lot of fun. Well, I want to move on to your topic because it is so interesting, and it's one that I personally haven't seen a lot about in the United States. Tell me, what made you decide to develop this particular class?
This particular class. Well, I know that, let me backtrack for a second. I know that each individual or different therapists out there use different modalities, and we address different issues that clients present with. For example, if someone's treating someone for a pregnancy massage, or they might have some congestion and swelling or discomfort in the breast tissue because of swelling, right? There's an indicator for breast massage. Or premenstrual or menopausal tenderness, that's another indicator for breast massage. They could have had a breast injury or post-surgical symptoms, which I'll specifically talk about, or discomfort from other cancer treatments in different areas. See, so there's a lot of indicators. Now, we have individuals that might be treating someone for shoulder issues, plus the person might have altered sensation and swelling. So the technique of treating for breast massage is indicated in various locations and during various treatments. So by bringing or making people aware that this is a possibility, this is a modality, this is a treatment that should also be included, and bringing people up to date or making sure that they have the knowledge and the technique to also apply this will also expand and broaden their product or their services that they offer to their client. Does that make sense?
I think so. So what you're saying, and I'll just try to clarify to make sure I understand, what you're saying is that breast massage actually has a lot of indications. It's not just someone who's had a mastectomy or breast implant, but rather it could be, like you said, from pregnancy, postpartum, menstrual issues, breast injury, and so forth, and someone who's treating a shoulder issue or a neck problem or something of that nature may run into some things that could be benefited by the breast massage.
That is correct. Okay.
Okay.
So, and when I'm looking at post-surgical treatment, I'm not specifically looking at, we have to do a breast massage for post-surgical, because, as we continue on this conversation, you'll know that, unfortunately, the individual will have had their breast removed. So I don't look at it as a breast massage, in essence, whereas we're going to be working on scar tissue and rehabilitation. Okay?
Okay, so, I understand.
So there's sort of two ways of looking at it here: breast massage technique that you can use, and then there's breast massage, and then there's treatment of post-surgical treatment of mastectomies. So the person has it removed, has the breast tissue removed. They may have it augmented or implants at that time. But it's still, I guess, it's still a combination of breast massage that you can incorporate into your treatment, depending on, not necessarily depending just on post-surgical.
Okay. Well, that definitely makes sense. So are there any particular symptoms? I know you mentioned swelling.
Yeah.
Any particular other symptoms that a person might be experiencing that a therapist would then conclude, some of these breast massage techniques would be beneficial here?
Yeah, let me backtrack just for a second on that also. A lot of times, it is breast massage sort of is viewed by the public not always in the positive light. As soon as you think about breast massage, you have to be very careful in essence, in that sense. So, for example, when a person does come in and you've done an assessment on the person and they're saying, I have some pain across, in the breast tissue area, automatically, as a therapist, we're taught, and it's part of our regulations, that you don't automatically say, okay, you need a breast massage here. Usually what I have is a pamphlet that describes breast massage and the indicators and the reason why, so on and so forth. And I usually like to hand this to the client, because mentioning breast massage right off the bat might change the client's perspective on getting a treatment, makes them nervous at the time. It's a very sensitive area, okay?
Right.
So more times than not, what I end up doing is I bring it to his attention that possibly you might be feeling because of this after my assessment, and I usually do an assessment to rule out and to confirm some of my hypothesis or some of what I think or where I think the pain is referring from. And so you do an assessment, and after you do the assessment, then you determine that, oh, yes, my hypothesis or my reasoning was correct, and it is coming from the breast tissue. So I believe that you may need also, in addition to the treatment I'm giving you in the shoulder and the arm and the upper pectoral area, you may need a breast massage. And right at that time, you want the client to feel comfortable. So you give them a pamphlet, and you ask them to think about it. And if that is the case, and they're not comfortable with you, then, of course, you want to refer out, okay? So, but a lot of times, just to bring that on or say that to the client sometimes becomes scary, I believe. What do you think?
Oh, I agree with you. That's, one of the things that I've been mulling about as I was preparing for this interview is how exactly do you approach someone with this? Because I'll tell you, I've been a massage therapist for 17 years, and just now am I starting to find that clients are becoming comfortable with me, and maybe this is a limitation I've set on myself, but with doing abdominal massage and work on the upper pectoral muscles to release pain in their neck and shoulders. And, perhaps that is my own limitation, but I've found that it has taken a long time to develop a relationship with clients to be able to do that. And I think with the people that trust me, if this were indicated, it might be possible. But for a new client coming in, I'm thinking, wow, how do you explain this to them? Or how do you even market this outside of getting referrals? So I think you're right. There are a lot of emotions and fears tied up in this type of work, and certainly that's going to be a concern of therapists that are thinking about adding this type of modality to their practice.
Yes. Well, if I can interject just for a second there.
Oh, sure.
See, when it comes to, when a new client comes in, they're coming in for a specific treatment probably, shoulder issues, ankle, knees, hips, something along those lines. Unless they specifically come in for a breast massage, then more times than none, I actually don't mention it. I keep pamphlets on hand for information for clients to take away. There's no need to mention that. There's no need to bring it up usually, right? But if along the treatment plan or along the process, the client comes in a few days later or a couple months later and says, I'm starting to feel pain across this area, then I'll probably do an assessment, as I mentioned earlier, pass a pamphlet on to them, and just bring them up to date as to what might be causing the issue. And by educating the client, that's first and foremost the best route to making them feel comfortable and also showing your professionalism and maintaining those boundaries.
Well, that sounds like a great suggestion, and certainly you've done a good job with your own practice in developing a lot of referrals and building your business in all kinds of areas. In relation to the breast massage or integrating this into some other treatment, what are some of the conditions or symptoms that a patient might be experiencing that would lead you to think, okay, this is something we need to integrate?
A lot of times, we're talking about post-surgical, am I correct?
Well, sure. I'm honestly, I'm kind of asking about generally, but the post-surgical would certainly be a part of that.
Okay, as an indicator, someone would come in. I'm about to do as I mentioned, I'm going to do a prenatal massage, and the individual has come in with stiff shoulders and mid-back pain, for example. And then she also mentions that the breast tissue is a little sensitive. Is there anything I can do for that? Okay? So right off the bat, I mention a couple things. I will say I'll give them some self-care that they can do, with a cold compress, a long towel that you can roll it up and put it in a figure eight for self-care at home, similar to a cold compress to help reduce any swelling and help to ease any pain that they may be feeling. Those are some of the options. Okay, so I usually try to investigate some of the options first, and then also, once again, I go back to giving out information about breast massage and some of the indicators for breast massage, such as congestion and swelling, which is indicated in this case. But once again, the person may feel uncomfortable, but I want them to feel comfortable, so I'll hand them a pamphlet and say, this may be occurring here. It happens in a lot of women, which is indicated and noted in the document here. And so they can take it with them. Sometimes right on the spot they say, yes, I'd like that done right now, please. Okay, and so from there you proceed. But each step along the way you also confirm with the client, and of course you're going to ask how they're feeling, so on and so forth. And that is one indication of it. Or, for example, I had a client the other day that had trouble lifting her arm and also lateral rotation of the shoulder. At the same time, she's tried all various things and various modalities, and then she came in and we did an assessment, and I pointed out to her and I said, look, here is where your pain and stress is referred from, and she said, yes, that's exactly where it's coming from. And then I said, well, it's indicated on the side of the breast tissue and also just in the sternum area closest to the breast area. And I said, well, it would be indicated for you to have a treatment, including this, your diaphragm, your abdominals, and the pectoral area. And she said, well, that's great. I'm going to think about it. I gave her a pamphlet, and then she came back a week later for the treatment.
Great.
Okay. So it's always good to inform. Sometimes individuals are going to respond right away, and then sometimes they'll. But at least you've informed the individual, and you've done your best to stay professional.
Well, I think that's really important with this type of work. As you said, it's emotional for some people. They may, and I would think, too, with having a male therapist talking to them about it, there may be some additional concerns or hesitation, which I want to talk about in a minute. But definitely, I think that education and giving them the choice, making sure that it's not something that while they're laying on the table, you say, I think we should do breast massage on you today, but rather, really letting them think about it. So from what you're saying then, Paul, it sounds like there are a number of symptoms that someone might have: the swelling, pain, trouble lifting their arm, maybe tingling or numbness in their fingers.
Oh, yes.
That type of thing. Is there, I'm curious, I don't know, it may be difficult to explain over the phone, and in the interview, maybe an easier thing to demonstrate, but is there something that a therapist could do, one thing in particular that someone could do to help that tingling or numbness in the fingers? I mean, I know I get that complaint from clients a lot.
Well, that goes back to education again and everything else, which I'm going to make the assumption that, prior to treating someone on the table, regardless of what issue they come in with, everyone usually does a clinical or orthopedic assessment. And with that in mind, the person comes in, as you mentioned, with tingling in the fingers, right? Then from there you want to narrow down, and in order to narrow down and confirm your assumption that, tingling in the fingers could come from the median nerve, it could be entrapped at the elbow, it could be entrapped during the scalenes, or under the clavicle in the first rib, or under the pectoral muscle before it innervates the arm and the upper body. So there's various locations where the entrapment could occur. And I'll use myself as the example here, what I would do in that case is do an assessment to try to determine where the impingement is occurring, and then look at how to relieve the impingement and the pain and what the referral pain, what's causing the issue. And that's how I would look at it initially if a person came to see me with numbness in their fingers.
Well, definitely doing everything you can to determine the source or the potential sources of the problem, and then setting up your treatment plan and recommendations. Definitely. Is there any special, with the breast massage in particular, is there any special massage technique that you employ when treating someone who's undergone a mastectomy? I know that's a really brutal surgery. I've had a couple of friends recently go through that, so I'm curious. Well,
of course, every client is different, and their symptoms and their presenting issues are also different. So let me use a middle ground here. Here's a quick scenario. Someone comes to see me that post-surgical, post-radiation, post-chemotherapy, and so let's say instead of double mastectomy, let's say a left breast mastectomy, so a single mastectomy, no augmentation, and they haven't put in a implant. Okay, so the individual, of course, might come in a little bit depressed, rounded shoulders. Okay, part of their they're going to have that feeling of their sexuality has been removed. Okay, it's very emotional. Their spirit is fragile, and if you look at the physical makeup, we're looking at slightly rotated shoulders to hide or protect that mastectomy, the removal of one of the breasts, right?
Right.
And so the scar tissue, a lot of times, it might go just underneath the armpit, depending on the severity. In addition, they may have had some nodes removed, and depending on the number, they can have some swelling or edema in the hand or not. Now, in that case, for example, the individual may have restricted movement on lateral rotation of the shoulder. And also, as they try to lift the arm towards the ceiling or even comb their hair, they're going to have difficulty because they're going to feel pain and pulling from the scar. In addition, you've just had surgery, and so if you think about gravity taking its effect also, you have gravity from the opposite or contralateral side, the breast pulling laterally. And you used to have another breast which used to counterbalance that. So now you have some pulling across the chest. You have the scar tissue. You have pain, discomfort. You have limited range of motion. The person might be hunched over and holding their arm in that position. So now they've reduced the amount of movement in the shoulder. So other shoulder issues might arise. How is that for a starting position?
Right.
Okay.
Right. So you've got a lot to deal with there.
Mm-hmm. And so what I like to do is give right off the bat, when I first see the person, we're sitting down, we're talking, I'm explaining the whole procedure of right from the interview and health history intake, right up to this is how I'm going to assess you. I'm going to assess the shoulder this way. I'm going to be moving in this direction. Later on, I'm going to ask your opinion and advice and consent throughout the whole treatment, right from sitting down and discussing right from the health history. And so from there, I'm going to discuss the position we're going to be in, whether you're going to be face down, sideline, face up, so on and so forth, and throughout the whole time, the various treatments and the application that I'm going to be using. It's a big process, but it's very rewarding for both the therapist and the client.
I'm sure it is, and it sounds as though you provide a lot of solutions and can teach therapists how to give those solutions to people that maybe haven't been able to find them anywhere. Mm-hmm. I'm sure, as you said, there are lots of things that are going on with post-surgical issues, emotionally as well as structurally, and from a pain perspective. I'm curious, in your particular work, and I'm sure every practice is going to be different depending on how they integrate this, but do you get a lot of this type of work as a referral from physicians or surgeons?
I guess a lot is subjective, but I get quite a few, a steady flow from other therapists also, and some physicians, and a lot of referrals from other clients, okay, because, of course, word of mouth is usually the best way for advertising, I believe, right?
Definitely.
Mm-hmm. And so, I get quite a few referrals this way. As I said, each individual is special, and I treat them that way, and regardless of whether they're coming in for post-surgical treatment or just for shoulder issues or a tight quadricep muscle. You want to treat everybody the same with respect and a high level of professionalism.
Oh, most definitely. And I'm sure one of the topics that I tend to teach about, particularly in massage school, I teach business and ethics, and one of the things that comes up a lot is male therapists and how they deal with being a male in a female-dominated industry, with yourself being a male therapist in the massage industry, and one who performs breast massage. Have you come across any roadblocks when dealing with clients? And, if you have, I'd be curious how you've dealt with them.
Good question. Right off the bat, even at school when we were learning, that was one of the questions that came up prior to us becoming therapists. And you have to think about that, and you think, well, in the industry, how would I feel as a woman being treated? Okay? Now, so I put myself in that position, and then you have to backtrack and think, okay, a client coming in is, of course, as I mentioned earlier, independent and special, so on and so forth. But what you want to do is treat everybody the same. When I say the same, I mean as in with total respect, regardless of the age or sex, and regardless of what issues they come in with. So I've always lived by that. And if you do that, I think that the client will see that you have the respect for them, and you're looking to educate them, and you're bringing whatever information you have to the forefront so they can make informed decisions. And in doing so, I haven't had any, knock on wood, I haven't had any issues whatsoever. And individuals that have been maybe timid to start off with or think, geez, I wonder if I should have a treatment from a man, ends up having a treatment and then referring in a friend afterwards.
Great.
So in essence, I haven't really had any issues with it, because regardless, as I said, I think it's just treat everybody with respect, and there isn't any connotations or anything like that. It's just you keep a professional boundaries, a professionalism about you, and I believe you can work with anybody.
Well, and having met you a number of times, Paul, you definitely have that professionalism aura about you. I would definitely be someone that would be willing to recommend clients that needed this to you. And if I were to need it, I think I'd feel comfortable with you as a therapist. So you've done a great job on that, and you provide a wonderful model for other therapists, other male therapists in particular.
Thank you. I'm turning red right now.
Oh, well. Well, you don't need to turn red. It's the truth. I'm not trying to flatter you. I just want you to know that I think it's important for us to have good role models, and I think it's you being out there and doing this and teaching on it is definitely showing what a professional you are, and absolutely how far a male therapist can take massage therapy. One last question here related to the topic. What advice do you have for therapists that are interested in integrating breast massage or these types of treatments into their practice, or bringing this as something available to their clients?
What advice? I think initially what you want to do as a therapist, put myself as I'm reversing the roles and saying that I'm a new therapist that wants to bring this into my practice. What I would probably look to do is educate myself on some of the signs and symptoms, some of the pitfalls, such as what would happen in this situation or that situation. Also, from a client's perspective, look at the emotional content that they're going to present with, the techniques that are employed when treating breast massage, some of the consent that's required, just probably in different, I'm not too sure, but in different states, I don't know if they require different legislation on application or regulations.
Most do, to my knowledge. I mean, as far as draping requirements and so forth, and what is allowed or what you have to get special consent for and that sort of thing.
And this one, it's not regular, but it's suggested that we usually get special consent for that. And also draping. When it comes to draping, you can also treat the breast if you're doing breast massage over the sheets, or if the client is agreeable, where you're going to undrape the area you're going to be treating and then redrape, so on and so forth. But I think the best thing is to bring yourself up to date and make yourself known to your clients that, yes, this is something I'm starting to offer, but I'm offering it if it's required and if it's indicated. And then, there are some pamphlets that individuals can pick up and display in their clinic or carry with them when they're disseminating or giving out information to clients.
Excellent. Paul, I know that a lot of people are going to want to take your class at the American Massage Conference, but for those who aren't going to be able to make it or want to find out more about you in the meantime, how can they learn about you and the other classes that you'll be offering?
Is it okay to say my website here?
It is.
Perfect. Well, you can find out more information at my website under www.paullewis.ca. That's LEWIS.ca. That's exciting.
That's
Thank
great.
You.
Well, I know that people are going to want to learn how they can sign up to come to your class, so I'm going to tell everybody about that right now.
Mm-hmm.
We'd like to invite everybody listening to be a part of the first American Massage Conference. This is put together by Scott Dartnall and his wonderful team of partners. You may have met them up in Canada or even in the U.S., Angie Patrick, Monica, Robin, and Lorna, who all have complicated last names that I can't seem to get out without stumbling over them, so we go by first names. But they're a great team, and they've put together a fantastic conference. Only $40 gets you access to 25 free one-hour CE classes, as well as access to the trade show with top massage product and equipment manufacturers and vendors. Besides that, at $40 gets you a ticket that is makes you eligible to win up to thousands of dollars in door prizes. Let me tell you, having been at the Canadian Massage Conference and seen all the good stuff that these guys get to give away, this is worth the ticket price all by itself. So please make sure that you pay attention to the raffle or the prizes that are being given away when you come to the conference. Additionally, at the American Massage Conference, we will have the first ever National Massage Therapy Job Fair. That's going to be on Sunday the 22nd. And this is not just for people that live in Atlanta. This is a national job fair. So there will be national, state, and local employers on hand. Bring your resume, and you could walk away with a new job. Something very exciting and something that has not been offered on that scale before. Additionally, there will be over 100 hours of continuing education available from a variety of instructors, including Paul and myself, of course, through 3-hour classes as well as full-day and 2-day workshops. And so you can register for those along with coming to the general conference. For students, we have a free student day and Smart from the Start presentation that's going on at the conference. And on Friday, we're going to have a full free day course with Laura Allen on how to pass the MBLEX and NCB exams. This is sponsored by ABMP. And for the first 70 people that are in the class, you will get a free copy of Laura's book on the same topic that is donated by Lippincott. Of course, all attendees are invited to come to the Saturday night gala, where there will be food, drinks, and live entertainment. Hopefully for Paul and me, there will be some dancing too. So we invite everybody to get their tickets at this event or for this event when you register. Again, this conference is very affordable. The hotel is only $121 a night. That's the conference hotel where all the action will be going on, so you definitely want to stay there if you can. $121 a night, whether you stay by yourself or you decide to split your room with up to 3 other people. It's so affordable, you really have to do it. And as a reminder to everyone, the show guide is going to make up the center spread of Massage Today's May issue. This is going out to over 62,000 massage therapists and will be available free at the show. This will be the first nationally circulated conference show guide, and so there are some amazing advertising opportunities. So if you're a vendor or an educator that's listening in today and you want to get some great exposure for your products or classes, please contact Sandy Pierce. It's her birthday today. Contact Sandy Pierce at Massage Today for details on being a part of the show guide. Of course, the American Massage Conference couldn't happen without the support of all of our global sponsors, including Massage Envy, Massage Warehouse, ABMP, and Massage Today. We thank all of them for their support in this year's event. If you'd like to find out how you can attend the American Massage Conference, May 20th through 22nd, or register and come meet Paul, attend his class and the other classes of the wonderful presenters at this year's event, please visit the official conference website at www.americanmassageconference.com. We also invite you to stay connected with us on Facebook at www.facebook.com/American Massage Conference. I hope after today's discussion, everybody listening is ready to come to Atlanta and to check out and register for Paul's class, Post-Surgical Treatment of Mastectomy and Breast Implants. Paul, thank you so much for taking the time to share this information today and just for taking the time to be here with me. I'm really looking forward to seeing you in Atlanta and looking forward to your class at the American Massage Conference.
Mm-hmm. Thank you very much for having me on the program. I'm also looking forward to sharing with the participants and other professionals at the conference, some of my engagement techniques using Dynamic Angular Petrissage, but most of all, I'm just actually looking forward to being there.
Well, it's going to be a great time, and I can't wait to get down there with everybody, as I'm sure you can't either.
Mm-hmm.
So this is Felicia Brown, and on behalf of everyone from the American Massage Conference and Massage Therapy Radio, I want to thank you for tuning into this broadcast of the American Massage Conference pre-conference broadcast series. Please remember to check back for upcoming interviews each week between now and May 20th. We look forward to seeing you in Atlanta in May. Thanks again for tuning in, and have a fabulous day.
Come again. Let there be plenty. Let there be plenty love.